can activate the emergency response team to resuscitate this patient, or I can follow this patient's wishes and allow him to die peacefully at his bedside. This can happen to you or to someone that you love. I'm a certified critical care nurse. I've worked in the medical ICU for 25 years. I've seen patients of many ages, races, cultures, and different diagnoses. I've seen people live and I've seen people die. Because God values human life, nurses are responsible to value human beings, regardless of race, age, culture, or circumstances of health-related illnesses. I will now present to you 3 ways nurses can promote God's value of human life through compassion, accountability, and respect. Let's begin. Compassion is a vital way that a nurse can promote God's value of human life. The Greater Good of University of California, Berkeley defines compassion to mean not only to suffer with, but it is the feeling that arises when you feel motivated to relieve that suffering. Your patient may be in extreme pain. As part of a nursing duty, you should provide that pain medicine as quickly as possible. You should follow up with that patient and make sure they're getting pain relief. That's part of compassion. The patient also may have gotten a diagnosis of cancer. The patient will be devastated at that point. Another compassionate job for the nurse is to be there for that patient and provide what they need. President Obama states, America's nurses are the heartbeat of the medical system. It doesn't matter what's wrong with the patient, but how you respond as the nurse. And philosopher William Penn stated, if there's any goodness I can show, or any good that I can do to any fellow being, let me do it now and not deter or neglect. Another way to promote God's value of human life is through accountability. The American Nurses Association Code of Ethics states, the nurse's primary commitment is to the patient, whether individual, family, group, or community. As a nurse, we are responsible for the care that we give. The Nightingale Pledge, composed by a nursing instructor, Lystra Gretter, states, I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and I will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty, I will endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. As a nurse, I'm accountable to keep you safe. Protecting your life is my job. The last point I want to talk about is respect. Respect should be given to each individual, regardless of age, race, culture, or illness. The Nursing World Organization states that the patient has a right to respect and non-discrimination. The patient has a right to privacy of health information. The patient has a right to make decisions about the plan of care before and during treatment. The patient has a right to review his medical records. As a nurse, you must respect their wishes. Luke 6:31 says, do unto others as you would have them do unto you. In conclusion, nursing is a unique field that has many ways to promote God's value of human life. Compassion, accountability, and respect are ways to promote these values, regardless of age, race, or circumstances related to the patient's illness. I will conclude with a poem, A Nurse's Prayer, written by Addie Leverty. A Nurse's Prayer. Dear Lord, please give me the strength to face the day ahead. Dear Lord, give me the courage as I approach each hurting bed. Dear Lord, please give me wisdom with every word I speak. Please, Lord, give me patience as I comfort the sick and weak. Dear Lord, please give me assurance as the day slips into night, that I have done the best I can, that I have done what is right. Thank you.